I'm Aanandita Vaghani, a mental health counselor and founder at UnFix Your Feelings, a cognitive behavioral therapy clinic in Mumbai. Let's look at mental health global trends. Let me tell you for a second that undiagnosed mental health challenges go a long way in affecting not only an individual's mental health, but an organizational's productivity. So if you think about undiagnosed depression, and we look at the statistic, the loss caused by undiagnosed depression is $1 trillion on an annual basis. When we look at India as a statistic, the number of people that need mental health support is so large, but there are not enough mental health therapists to cater to this need. When we're talking ratios, it comes down to 0.001 psychiatrists for 1,000 people who need that mental health help, who need that mental health support. In India, every 1 in 10 or 20 individuals is likely to seek mental health help. When we look at a nation like America, that statistic rises to 35% of people seeking out that mental health help and support. So in the olden days, the mind and body was seen as completely separate entities. And now, as a science, we're coming closer to the idea that the mind and body are not separate entities. They're related to each other. In fact, they're connected to each other. In a way, what the mind suppresses, the body expresses. So a lot of clients may come in with concerns like a stomach ache, which might actually be anxiety. And that's because of the gut-brain axis. And it's also because of the fact that we have neurons in our stomach. So ultimately, what we feel emotionally ends up affecting us physically in a big way. In a country like India, where physical concerns are more acceptable to talk about than mental health concerns, it is quite natural then that when clients come in, they are more likely to come in with physical or somatic symptoms rather than psychological symptoms. So a lot of times, whereas clients or patients need to go to therapists for help, they may end up going to gastroenterologists or GPs that might not have an answer to their problem. At a systemic level, I think we have a big job when it comes to mental health therapists as well as policymakers. A big change that we need to make is in our education system. And I strongly think, as a lot of people from my fraternity would, that emotional intelligence must be part of our curriculum. Because to teach people how to be aware of their thoughts, their feelings, and the impact that it has on others can really change the way we think, behave, react to situations. And I think when we're talking about the systemic level, we're also talking about healthcare, we're also talking about doctors who maybe as an add-on to your physical examinations that go on a yearly basis or an annually basis, you can add an element of diagnostic checks for mental health as well. You can have mental health practitioners on your team when you're doing that body checkup. I think these are small but necessary changes that we need to make at a societal level to help the state of mental health care in our society. Growing up, I had a learning disability, and this is what led me to the field of mental health. I realized that when I was growing up, if there were more resources, if there was more support for me, then I would be more likely to get the help I needed. And this became my mission from that day forward. I started reading books, finding strategies to help myself, and eventually I was on a mission to help others. I went on to do my bachelor's degree in psychology at Wesleyan University in Connecticut. And during my time there, I learned about the different cultural influences on mental health, how mental health challenges in the US are expressed more in psychological terms because it's more acceptable to do so. But that was not the same in countries like India or China. After this, I also ended up going to a variety of summer programs where I learned about the importance of and the interplay of genetic and environmental factors in our mental health and the development of our mental health. After this, I did my master's in New York University in mental health counseling and wellness, where I learned a variety of techniques that I could apply to various populations when it came to mental health care, when it came to the diagnosis and treatment of mental health care. I worked with a couple of US organizations, after which I came back to India and I realized the need of the hour really was to start an organization, a private practice, that could destigmatize mental health care and make it accessible and make it a topic that we speak about more. I also realized that through my education, something that I noticed was that we always try to see emotions negatively when emotions really aren't dangerous at all. In fact, they are a compass navigating us back to our needs, navigating us back to our moods, our wants, our awareness. This is what led me to starting my private practice, UnFix. Emotions like anger are seen as negative, when in fact anger is the biggest motivator for social change. This is part of the work I do here at UnFix, to psychoeducate my clients about the importance of emotions. The name UnFix comes from the notion that when we do have an emotion, we try to run away from it. We use Netflix, we use eating, we use alcohol, we use Instagram, and all of us are guilty of this. What we might do instead is sit with our emotions and reassure ourselves that it's safe to do so, to point us back to ourselves. Through UnFix, I help a variety of clients dealing with anxiety, depression, post-traumatic stress disorder, body dysmorphia, among many concerns.